name's Sumantha Gabriel. I work at the Northern Centre for Cancer Care in Newcastle. I'm the lead haematology pharmacist, and I work with all malignant haematology, which includes CAR T, which is a form of transplant. I also work with the Northern Alliance Advanced Therapies Treatment Centre in collaboration with the CAR T therapies that we're conducting here. CAR T-cell therapy is chimeric antigen receptors T-cells, where cells are removed from a patient's body, genetically modified in a laboratory, and then reinfused back into a patient, and then they are essentially weaponised to fight against the particular cancer that we are trying to treat. It's associated with quite specific side effects that we haven't really seen in many treatments in haematology. So two of these main side effects are CRS, which is cytokine release syndrome, and ICANS, which is immune effector cell associated neurotoxicity symptoms. And these are quite specific to CAR T therapies and are treated quite differently to how we would normally manage side effects within haematological malignancies. CRS can be indistinguishable between a temperature and symptoms we would normally see in a patient, but it is actually called cytokine release syndrome. So it is actually the body working to fight against the cancer and these T cells. Patients can have high temperatures and feel really quite unwell. They can have blood pressure drops. The neurotoxicity syndromes are actually quite a different set of symptoms we aren't used to seeing at all. Patients can be confused, their handwriting can become irregular, they can't count properly, they might not be able to speak properly, they might fit. So these are quite a new novel set of symptoms in this area. Some of these toxicities actually can be quite long term, so we've seen in clinical trials and in real world actually they can be acute, but it can also happen up to about 3 months after patients have had therapy, when patients have been discharged from hospital. All patients who have received CAR T therapy are issued with an alert card, which is provided for by the said drug companies. And on those alert cards, it tells you what the treatment is and what the phone number is for the patient to ring in case of an emergency. However, as with all cards, patients could obviously easily forget that they have this card. They are given huge amounts of information, also could feel quite unwell, and they may not remember they have this card, they may not even remember they've had the treatment. And we know that patients do forget a lot of information that's provided with them. So we've come up with the idea of a wristband so that patients can just wear it on their wrist, and then they can show anyone healthcare professional they may interact with. So if they turn up at their local A&E department, community pharmacy, GP surgery, whoever they encounter, if they don't feel well, they can show this wristband, and it has their patient-specific hospital's CAR T number on, so that in an emergency, anyone can ring that number. The idea behind the wristband is really that if a patient presents to any healthcare professional who isn't familiar with CAR T treatment, even if it's their local hospital or community pharmacy, etc., that they can show the wristband, and the healthcare professional can then contact the CAR T centre where the patient was treated immediately for advice on how to treat the patient, or whether they then need to be transferred back to the original centre. Normally these things could be dealt with in-house within a local hospital, provided they're advised by their centre. The wristband project has been supported by the Pharmacy Working Group for Advanced Therapy Medicinal Products Clinical Subgroup. In partnership with one of the drug companies, Gilead, we have been able to do a private project where we have produced these wristbands. Each hospital, there are 10 centres in the UK who have signed up to this, and each hospital has their own specific number written on the wristband so patients can wear it. These can be used in conjunction with the alert card, which must be carried by the patient. It's a year-long project. We hope that it will continue. We're going to look for feedback from patients and healthcare professionals to see how these have been used and how well they've been received, to hopefully continue this in the future as more CAR T cell therapies will come on board.